washing my hands. Hello, my name is Haley. I'm going to be your nurse today. Can you tell me your name and your date of birth, please? Okay, thank you. Do you have any allergies that we need to know about? Okay, and then I would make sure there's no safety risks in the room that could cause harm to the patient. Okay, so today we're going to be doing inserting a nasogastric tube to give your stomach some relief. So we're just going to elevate the bed real quick. You want to make sure and get them in the right position. Is upright. And then I'm going to go ahead and drape this over them just in case they do throw up, so it doesn't get all over their gown or their bed. And then we're going to put this in front of them in case they throw up. Okay, so I'm going to don my gloves, and I have all my supplies over here and ready. We're going to make sure we've done the right assessment on the patient, make sure there's no issues when it comes to inserting a nasogastric tube. Nothing that can interfere with it. So I have my tube right here. I'm going to measure from the nostril to the earlobe, and then down to the xiphoid process, which is at about 50, which it won't go in that far because it's a mannequin. And so we'll have a glass of water here for the patient as well. So you'll lube the tube up, and go ahead and I'm gonna go ahead and put this in the basin just in case any drainage does come out immediately. And so we're gonna have them tilt their head backwards, insert the tube in a swift motion. Once it gets to their pharynx, have them tilt their head down to their chest and drink some water to get it to go in more, and it won't go in very well because it's a mannequin. So in reality, this would keep going, and then you would have made it there. Hopefully there's some fluid coming out of here. And then we're going to tape it. So we'll put this one over their nose. And then we're gonna put this there. And if they do start like choking, like they can't breathe when you insert the tube, that means you've entered the airway and you need to stop entering the tube, take it out, and then probably give them a rest for a second and try again. So as you wrap this around, you just ensure that it's stable. Okay, and make sure that's okay. All right, and then to ensure placement, we're going to hook this syringe up with air in it, and we're going to put some air through the tube, and you can listen down here with your stethoscope to see if you can hear it. But you want to ensure placement before you hook any feeding up to this, or before you take anything, suck anything out of it, or hook it up to suction. And so in order to do that, you'll get a sample of fluid, and then you'll either send it to a lab or do a test yourself to test the pH, because the pH will determine the location where that fluid's coming from. Okay, so let's pretend the placement was good. It was in the right place. So we're gonna hook this up to suction. Okay, we're gonna hook this up to suction, and then you'll make sure you document the correct information, and you'll monitor them periodically and make sure you're checking the characteristics of the different sputum or gastric fluid that's coming out into the suction cup. And then you would take off your gloves and wash your hands. Okay, so now they don't need the gastric tube anymore, the nasogastric tube, so we're going to take it out. So what we would do is we'll have 30 milliliters of saline here to flush with, and we're going to clamp this tube. We're going to clamp their tube and then unhook it from suction. And then we're going to take the tape off of the patient. While you want to make sure you stabilize it. Oops. And then you want to make sure and look at where that tape has been on their skin, and just assess the skin area, and make sure that you're being gentle when you're taking that off of there. And then you can discard that. Okay. And so next, we're going to have them take a deep breath and hold it, and then we're just going to pull out in a swift, continuous motion. and then you'll discard this as needed, and you'll make sure that you assess the patient and that everything is flowing correctly. They don't have any signs or symptoms of discomfort or anything abnormal. And then you will take your gloves off, and you will wash your hands, and you will document the correct documentation.